Hi everyone, this is Ken from 125 Live coming to you from inside 125 Live in our river rooms. I wanted to utilize a projector today so that I could talk and present some information so that you guys can learn a little bit something new, hopefully something new. I've been able to spend the last couple of days scouring through reputable sources to find legitimate information regarding COVID-19, risk factors for complications regarding that disease, as well as tips and tricks for long-term wellness for 125 Live members, as well as the general community of Rochester and the surrounding areas. But I do have to point out, although I am going to be presenting some information today, all of it will be reputable and will be credited within the presentation. I am an exercise physiologist. I am not a physician. I am not qualified to diagnose or treat any type of illness. And I just want to remind everyone that I am the guy you complain to when things break. So unless it's talking about fixing a treadmill, I do encourage you, if you do have questions, to reach out to your primary care physician or nurse hotlines. Those resources will be presented in this presentation as well. So be ready with a notepad and paper. As we move forward, I would like to state one quick positive as we get into the presentation. I just added this slide moments ago. The Institute of Health Metrics and Evaluation from the University of Washington School of Medicine has revised its original estimates for Minnesota's hospitals, and indicating that from 2 weeks ago, the needs for ICU beds has actually lowered, and the Star Tribune presented that not only lower needs for ICU beds, but actually deaths and estimated deaths from COVID-19 in the state of Minnesota are going to be down. And due to compliance with state and local policies for social distancing, as well as closing large events and activities, the estimate for potential deaths in Minnesota has been lowered by 53%, which is an incredible accomplishment. And it kind of shows that we're doing the right thing by staying home and doing whatever we can until we're ready to be clear of this. Something that I hope that everyone's already had the chance to see, but I would have been in trouble for not adding it to today's presentation, is that according to the Centers for Disease Control, you should still definitely avoid close contact with people who are sick, avoid touching your eyes, nose, or mouth with unwashed hands, and wash your hands often with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer that contains at least 60% alcohol if soap and water are not available. I do want to point out that there are a lot of great resources in Southeast Minnesota for 125 Live members and everyone else. Was able to find out through the Minnesota Department of Health, should you have a COVID-19 question or a health-related question, you can reach out to 651-201-3920, 7 a.m. to 7 p.m., and you'll be able to speak with a health expert at those lines. Should you have questions about testing, if you are a Mayo Clinic patient, the number to call is 507-293-9525. Anyone else in Olmsted County who is not a Mayo Clinic patient is to contact the Olmsted Medical Center at 507-292-7266. Those three numbers I was able to receive from the Minnesota Department of Health website regarding COVID-19 resources. The next bits of information we were able to get from the Post Bulletin. Individuals who are unable to go grocery shopping or have concerns about grocery shopping during the COVID-19 crisis, I would like to encourage you to reach out to Family Service Rochester, as they provide a grocery shopping service with volunteers at 507-218-3267. That service does have a fee, but you can reach out to them if you have any questions or more information regarding that service, as well as the Channel 1 Food Bank at 507-287-2350. So for any more amazing resources in Southeast Minnesota, I would like to encourage you all to check out thepostbulletin.com and then search the keyword resources coronavirus, and you're actually going to wind up with several pages of amazing organizations that are working to provide services for those who might need a little bit of help during this pandemic crisis. So I'll also leave a link for this within the program description. One of the key things, and the reason why I wanted to present on this, is to talk to people about what's the difference between severe COVID-19 and standard COVID-19. And according to the Centers for Disease Control, risk factors for a more severe incidence of COVID-19 are for individuals being over the age of 65, living in a long-term care facility, having chronic lung disease or asthma, being immunocompromised as in individuals who are undergoing cancer treatment, transplant recipients, as well as smokers. One of the surprises for me, severe obesity or having a body mass index of over 40, diabetes, kidney or liver disease. These are the common risk factors according to the Centers for Disease Control that might be predictors of a severe case or having complications to COVID-19 infection. So we were able to do some research and we dug out through the American Lung Association some advice regarding what to do in the COVID-19 pandemic should you have lung disease or asthma. The advice that they gave us: do not stop taking your medications without your physician's input. Now, one of the risk factors for a complication regarding COVID-19 is being immunosuppressed. And some asthma and lung medications do cause immunosuppression, but under most circumstances, we're trading one mild risk factor for another risk factor. And it's one of those things that you should always consult with your physician before changing any of your medications. So, as well as that, quick relief inhalers, however, are bronchodilators and not corticosteroids and do not have any immunosuppressing effect. The greatest bit of advice from the American Lung Association is to eat well, sleep well, continue to exercise or begin exercising, and to stop smoking. Another of the risk factors regarding the CDC was heart disease. So we were able to find some information, Dr. Eduardo Sanchez of the American Heart Association, that people with heart disease or those who have a stroke should take additional precautions to avoid COVID-19. His suggestion, Dr. Eduardo Sanchez, was to pretend that you yourself have COVID-19 already and that you're taking every step possible to stop the spread amongst your loved ones, so that you, in fact, wash your hands more regularly, stay in when you can, and avoid large public spaces. Some of the other information that was shared through the American Heart Association indicates that preliminary data would state that some patients experience a situation of myocarditis, which is an inflammation of heart tissue, and this in turn leads to a dangerous heart arrhythmia, which complicates those especially with heart disease. And another bit of advice from the American Heart Association: to continue to take your meds unless advised by your physician not to. Now, when one stops taking meds for fear of complications to a COVID-19 infection, you're actually increasing your risk of other dangerous health conditions that you're taking those meds for in the first place. And if you have experienced shortness of breath, chest pain, or any trouble breathing, to definitely take the opportunity to call 911 or your primary care provider to find out what are your next steps. Individuals with the body mass index greater than 40, and that can be the equation is 703 multiplied by your weight in pounds after it's divided by your height in inches squared. The Miami Herald reports that obesity may increase the inflammation response and lower the immune response with individuals who are undergoing a COVID-19 infection. Excess weight may also add stress to your lungs and create additional breathing complications that increase the severity of a COVID-19 infection. As diabetes was a risk factor, the American Diabetes Association is really reminding people that having well-controlled diabetes lowers your risk of serious complications, and it kind of brings your risk down to about the average person without diabetes. COVID-19, like any other viral infection, can create additional problems for those living with diabetes, such as increased inflammation, swelling, and may cause diabetic ketoacidosis. Several different conditions that can do this is that you just want to definitely make sure that you're safe and well managing your diabetes. Those with liver and kidney disease, finding information regarding the British Liver Trust, COVID-19 may have a direct viral cause of injury as well as an immunoresponse-induced damage to liver and kidneys. This may lead to a multi-organ failure and in some cases death, according to the Centers for Disease Control. So individuals living with liver or kidney disease or organ issues are really going to be at risk and need to stay home and avoid contact as much as possible. So why this presentation? I really wanted to point out the guidelines of all of those risk factors and let everybody really know what might you want to be really looking out for. But the big draw of this presentation is what can you do to stay healthy outside of just washing your hands all the time. So we wanted to review some information regarding the best way to be active and to exercise to keep not only your sanity but also your general health and well-being during this pandemic. So we utilized guidelines from the American College of Sports Medicine, or the ACSM, for physical activity and wellness. It encourages all of you to be as active at least 5 or more days each week with moderate physical activity for 30 minutes or more. That would be walking about 3 to 4 miles an hour, which is a comfortable but quick, brisk pace, or the approximate exertion of vacuuming the floor or cleaning out your garage. Simply moving things, going from side to side, squatting down, picking things up. And especially do 2 or more days each week of resistance training. It does not require you to be in a weight room lifting weights and using machines. It does include using your body weight, getting up out of a chair, doing push-ups either off the floor, off a chair, or the wall, and that'll be something we present in another 125 Live video. And then we wanted to tie in, how is being physically active related to COVID-19? Well, as we improve our physical activity, we get working harder, we work out more, we're going to start to see some cardiovascular and respiratory functional improvements. That'd be an increased max oxygen uptake, and then also just increasing skeletal muscle and just being stronger and being more efficient, and then really primarily increasing exercise threshold for the onset of disease signs or symptoms. So individuals who have an ongoing cardiovascular issue, you will still continue to experience those conditions, but with rapid, regular exercise, we're actually going to change how your body responds and allows you to work harder before you actually start to experience those signs or symptoms. And it also decreases your risk of cardiovascular disease risk factors, thereby taking away some of those risks that are associated with the COVID-19 infection or the complications to advanced infection. And then being physically active just generally decreases morbidity and mortality. The idea is that you'll be healthier, feeling a little bit more likely to take on the world. You improve the decreased anxiety and depression, improve mental function, and just generally feeling better. So one of the things is, as we get through this, I'd like you definitely, if you have any questions at all, please leave them in the comments section below. I'll go ahead and do what I can to find details and information regarding them and how to best answer them. Thank you guys so much, and I'm looking forward to seeing you all very soon.